Hi, I'm Hassan. I'm a cardiology registrar working in Northumbria hospitals, and last year I was working as a teaching fellow in James Cook University Hospitals. My role as a teaching fellow preceded me taking up a post as a cardiology registrar, and it served multiple purposes. So, on the one hand, teaching is something that I am really interested in and I really enjoy. I'm a firm believer that teaching something is the best way to consolidate your own learning, and I think I'm the kind of person when I've learned something, I'm quite excited that I've learned it, and I love to pass it on. Um, and being a teaching fellow was a good way of doing that. Moreover, I think being a teaching fellow gives you the opportunity to pass something on with greater facility. So the first time I look into something, I might have looked into it in great depth. That's perhaps not necessary for somebody who's a third year medical student, but I can cut to the heart of it with the knowledge and experience that I have and make it that much easier to introduce new people to the subjects that I like and that they need to know about. The other good thing about being a teaching fellow is that it enables you to have time to do other things. Often in clinical medicine, we are so busy working our 9 till 5s and weekends and evenings and nights. And our portfolios demand that we do additional things like audits and quality improvement. And unfortunately, the current state of play is that these things are not timetabled into our working weeks. What's more, often to get into the careers that we want to do, particularly if somebody wants to get into something competitive, you often have to go above and beyond. And there really isn't that much time in most foundation and core training jobs to tick those boxes. So in that respect, being a teaching fellow is a breath of fresh air. The way your time is separated is typically a lot of teaching fellow jobs, you might have a 50-50 split between teaching and clinical work, but it's not always that way. Some are more heavily leaning towards the teaching, others more heavily leaning towards the clinical. I went for mine as 50-50 because I didn't want to become de-skilled, and equally I think the experience served me well and helped me get the registrar post that I've got today. Applying for a teaching fellow was actually a backup plan for me. I didn't get into cardiology the first time. And I think it's important to tell these stories because oftentimes when you're really junior in your career, or if you haven't come across any degree of failure, people assume that the people ahead of them just have had it all smooth sailing and have got to where they have without any sort of adversity. The actual reason I didn't get in, I think I was fairly poorly prepared, and working very busy clinical jobs didn't enable me to have the best CV. Interestingly enough, my specific clinical fellow post has a bit of a history and a bit of a pedigree. Many people have done that job after not succeeding to get a cardiology training number, and have then gone on to get a training number, including more than one consultant who worked in that place. So that's why I chose that one, because on top of that, the faculty have a very good reputation. So they're attached to Newcastle University, and everybody knows the teaching in Tees is excellent, and that's something I wanted to be a part of. The thing that I enjoyed most about being a teaching fellow was the relative freedom from the constraints of training and not having to keep a portfolio, having the time to pursue my own projects, whether that was an audit that helped me get into cardiology or just some reading around the subjects that I was interested in, or reading the really long clinical guidelines that I needed to know for my work as a registrar on call. But I had the time to pursue my learning within my job and to also pass on that learning to students. And what I really enjoyed about it was teaching a difficult subject, or a subject that students often struggle with or don't enjoy, usually something a bit more complicated that requires some physiology knowledge, some principles and some methods of interpretation, so slightly higher level skills like ECG interpretation, and teaching something like that to a high level and having the students feedback that they liked it, they enjoyed it, they found it useful. And I think some of the best feedback I got was somebody saying that they considered cardiology as a career after my teaching, which is definitely high praise, and although it was anonymous, I'm pretty sure I knew who that was. The most difficult thing about being a teaching fellow is teaching in a manner that engages all parts of the audience without alienating anybody. Now, there's always a person or two in the room who picks up whatever it is that you're teaching very quickly. So sometimes you feel like you need to challenge them, and other students may not realise just because you picked something up quickly doesn't necessarily mean you're the best at it, or indeed that you'll retain it. There's the students in the middle who pick things up at a steady pace and in the normal fashion, and then there are students who might take a little bit longer to get there, or indeed might take a different approach. And for me personally, I find it fairly easy to accommodate the students in the middle, the students who pick things up quickly, but sometimes it's a bit of a challenge for me to think of ways to explain things in more than one way, or to demonstrate things in more than one way. Throughout the year, actually working with my colleagues, I got ideas of how to do that, and I think I got better at it as time progressed, and that was an important thing for me. I consider a lot of this work that I do as a doctor as teaching, so giving an explanation to a patient is in effect teaching them about the disease that you think that they have. Just this afternoon I was teaching a patient about the difference between unstable angina, stable angina, NSTEMI and STEMI. Not because that's my usual practice, I don't like to overload patients with jargon, but this particular patient wanted to know in depth, so that's what I did. Of course, the explanation I gave to him was quite different to what I would give to a medical student, which is again slightly different to what I would give to a qualified doctor who's a bit further on in their career. And as a doctor, you have to have that facility. You need to have the ability to superficially sometimes explain what's going on, sometimes in greater depth. Sometimes you can't go in greater depth, but you need to know how or where you will go to find that information. It's okay as a doctor and as a teaching fellow to not know all the answers. I think the worst kind of person, doctor or teaching fellow, skims over their lack of knowledge and skims over their areas of ignorance. And I think we as doctors and teachers should be more open about the fact that not everything is known and there isn't always a simple answer. And I think that would take away a lot of the frustration of students and indeed patients in a number of situations. So teaching fellow roles are becoming more commonplace, but anecdotally I think they're also becoming a bit more competitive as well. Particularly if you want to work in a specific hospital, in a specific specialty, oftentimes people realise now that these are a good gateway into the specialty in higher training. So there is quite a lot of competition for these posts, and quite understandably. The interview process looks at your primary medical qualifications and what you've done since. So they will look at your previous teaching experience and what you have to say about it. There'll be some question about your desire to do teaching and why you want to do it, and also about the balance between teaching and clinical work, because often there is a split between the teaching and clinical work and you don't often get 100% teaching fellow posts. You may be asked to do some teaching or prepare a short talk, and that in itself presents a specific challenge. People often underestimate or overestimate, I think more commonly overestimate how much content they can get into 5 minutes, and I think in that tiny little task you can weed out some of the best candidates. I suppose that's not weeding out so much as selecting out the best candidates, as often people try and get in huge topics into a 5-minute slot. For people who are considering teaching, I would strongly recommend it. If it's something you enjoy, try it out. I've known people who have enjoyed teaching and have gone into it and have loved it so much they've stayed for more than 1 year. I've also known people who thought they might like the idea of it and haven't liked it, and that's okay too. What I would say is don't be too hasty in your decision making. Just because you don't enjoy something for a week or a month doesn't mean you won't enjoy it a few months down the line. Give things a chance, whether that's teaching or something else. I think teaching is great. I would personally recommend it after some clinical experience. I think you get a bit more trust sometimes from your students when they realise and acknowledge that you've got more clinical experience. That's not to say you can't be a good teaching fellow post F2 or even during F2, but I would strongly encourage people to do it. It was perhaps one of the best years of my career to date.